Dr. Satwik, I have to ask you, we are now, because before it was just numbers, I think, in a news organization, we are now getting anecdotally realizing the extent of the problem as well, because now all of us know people who have COVID-19. We're seeing every day, newsroom gets lots of stories about people finding it very difficult to get hospital beds. And the fact that they feel that the capacity and the kind of infrastructure may be inadequate. Can you tell us, as a physician, as a doctor, and as someone who knows people who are working in other hospitals as well, with dealing with COVID, is that backed up by instances that you see around? Is that your assessment as well, that right now we're not equipped, that people are finding it very difficult to match up the infrastructure and the logistics?
Yes, I think, and we're not even on the steep bit of the ascending arm of the peak. And if you're working to breaking point at this point, then I shudder to think where this is headed. Clearly, most hospitals are running to full capacity. The only beds that are available seem to be available in government hospitals. And that's largely because people tend to prefer coming to private hospitals rather than going to government hospitals. That shouldn't be the case, but that's what's happening. A couple of practical problems that one has to realize is that, let's say the app says that 10 beds are available in Gangaram Hospital at this point.
You're talking about Arogya app?
The app that shows the number of beds available in real time.
Right.
So let's say, for instance, I'm just trying to explain this to you. Let's say it says about 10 beds are available in Gangaram Hospital at this point. We have no idea how many people are seeing that app right now. So let's say 100 people show up at Gangaram, looking at that app and saying 10 beds are available. It creates a crisis. And you've got to have just allocation of available resources. So there's got to be triage that happens. You can't. There isn't an inexhaustible supply of beds anywhere. There isn't an inexhaustible supply of beds in the holding area or manpower. And as I've explained that, we're badly stretched because we're working with a depleted workforce. If you keep asking us to increase beds to treat COVID, where are the specialists going to come from? You can't ask an orthopedician or an obstetrician or a vascular surgeon such as me, because we are not trained in critical care medicine or pulmonary medicine to start treating COVID. So where's the manpower going to come from? All of these things need to be factored in when you're dealing with this. And as regards ICU capacity, it's essential for any hospital to keep at least 15 to 20% of the ICU beds with ventilator available in case the patients admitted in that hospital deteriorate. Okay, let's say someone's admitted and is currently on high flow oxygen, isn't on a ventilator, but is likely that might be going onto the ventilator in a couple of days. You need to reserve about 10 to 15% or 20% of the beds for in-house patients in case they deteriorate. If we start accepting very sick patients on the ventilator from other hospitals and filling up all beds, then in case patients in our hospital start deteriorating, which they will, there is a significant fraction of admitted patients on high flow oxygen who are likely to deteriorate. That is the cause of the disease. So where are you going to accommodate them? So I think it's important to understand that when it's being said that beds are not available, it's not because doctors are vile, degenerate creatures who are just refusing patients who are dying at their doorstep. There's probably a good reason why a bed is not available. And I think that should be communicated.
Final question. I mean, I could ask you lots of questions, but the course of interview, I just wanted to ask you, the final thing that has become very contentious right now is the fact that you can't, the Delhi government's also said that you can't let in people from outside. So are you all having to also now establish where a person comes from before you admit them? I mean, has that become another added headache, or is that seamless?
Yes. Not just that, I'd like to say that there's an order passed by the Delhi government that a senior nursing officer, Sarkari nursing officer, will have to be stationed in every private hospital. Consider the meaning of this and how Kafkaesque this is. A senior nursing officer from the Delhi government will be stationed in every hospital, and all admissions will require a sort of clearance from this nursing officer. Now, triage is a clinical decision. There can be no extraneous intrusion or interference in triage.
Can you explain triage for all of us?
Triage would mean a sorting procedure about which patients require admission, which patients might require oxygenation, which patients are likely to deteriorate. You can't follow a piece of paper as regards triage. This is a clinical decision which prioritizes based on merit who requires admission and who doesn't require admission. If you try and bring in a bureaucratic intrusion here, which is that you require clearance from a nursing home, I would have understood if someone who specializes in critical care medicine would have been stationed. If you have to do something like that, if you have to be authoritarian, at least you get experts in. You can't have a senior nursing officer deciding and perhaps ruling out specialists in the emergency room about who merits admission and who doesn't, based on a piece of paper issued by the government. As regards patients from outside of Delhi not being given admission, look, even for matters of filing income tax, I think, if I'm not mistaken, Delhi NCR is considered as one territory. But here, NCR is not considered as a territory. I can safely say 30% of the people who work in Ganga come from Noida, Gurgaon, Greater Noida, Sonipat. Some of our technical staff, our nursing staff comes from these areas. These patients come to Ganga, can treat patients in Ganga Hospital, but are not entitled to be treated for COVID in Ganga. This is how Kafkaesque it's become. It's very unfortunate, and there needs to be some course correction here.
Kafkaesque, I think that captures it really well. Finally, I always want to end on a bright note. Is the bright note the fact that, maybe because of the BCG vaccine or whatever, that yes, the numbers are rising very, very rapidly, but most of us, I know you said that, we should all prepare for most of us getting infected. So are most of us going to be okay?
Yes. Most of us are going to be all right. Most of us wouldn't even warrant an admission. And in fact, I'd say that if you're even asymptomatic and you've been a contact of a lab confirmed case, because the government is headed in that direction, that I don't think you'll be tested, even if you're a contact of a lab confirmed case and you're asymptomatic, and that's fine, because with a period of quarantine, you'll be all right. I think about 80 to 85% of people will be perfectly fine and will get out of this unscathed.
80 to 85%. That means you think that right now they're saying only 3% people are dying. That you expect to increase.
If you follow the line of argument that's been issued by Professor Sunetra Gupta from Oxford, who seems to believe that the case fatality rate is actually very, very low. The case fatality rate will always be a factor of the number of positive infections. That is always going to depend on the number of patients you're testing. Okay, so the more you test, the more positives you'll get, and on account of that, the case fatality is actually going to fall.
Yeah.
So I'd say on a realistic level, the case fatality might even be 0.5% or 1%. But the trouble here is that the denominator is very large. The combined population of Delhi NCR is 4.5 crore. If everybody starts falling sick at the same time, then even if you say 5% of patients require ICU admissions or, admissions in high density units, that's a lot of people. We don't have those many beds. So I think, which is why I said that behaviorally you must assume that lockdown is still underway. You shouldn't get out for inessential activities. Only get out if you have to earn a livelihood. Otherwise, you're safest when confined to your homes.
Dr. Satwik, thank you so much. I don't know if people feel cheerful after hearing you speak. I guess not, but we do feel like we know a lot more. Thanks so much for speaking to Hindustan Times. Bye.
Thank you.